that sound? Silent.
That's the beeping sound. So, say hi everyone.
Hi, everyone.
My name is Kento at Kamiyama Physical Therapy on March 25th, 2020. What's your name?
Mimi.
Mimi had joined us in an intro. We just did a webinar on sciatica anatomy that was hosted by our acupuncturist/physical therapist assistant, Daniel Burano. And we just explained sciatica very simply so you can explain to your patient clients easier. We have pictures, we have diagrams, we have models, and we have Q&A, so it's easier for you to understand. So this would be very helpful for those that are very scared about sciatica and want to learn things a little more easily. So please enjoy and have a great day. Bye.
Bye.
Hi, this is Kento at Kamiyama Physical Therapy. Welcome to our channel.
Anyway, a quick introduction again. Daniel Burano, acupuncturist in New York, along with the physical therapist assistant for more than a decade. He is also a adjunct professor for Seton Hall University for the physician assistant program and physical therapist program. So his anatomy knowledge is very, very like in the very expertise section. So Danny,
Thank you.
take it away.
Yeah. Thank you, Kento, for the introduction. And thank you guys for joining us in this fun day. All right. So let me start by sharing the screen a little bit so you guys can see what I'm doing right now. All right. Can you guys see the screen? Yeah. Looks like it. Awesome. So the main focus of today's lesson was to not just talk about sciatica, but we wanted to talk about like basically simplify the concepts of anatomy in a way, such a way that if a client comes to you and asks you about, oh, I'm feeling this pain along the back of my leg or having this pain or numbness, in a way, such a simple way that you can explain it to them and you guys can be on the same page, that's going to lead to better outcomes, right? So we're going to discuss a few elements. And of course, we're going to discuss the anatomy, components, and all of that. But we're also going to discuss common locations of impingement and the problem mechanisms too involved in it. And of course, we're going to discuss some elements to or recommendations to lessen those symptoms, but also to prevent it. All right, so let's get this party started. So the first thing is, like, as we know, if you guys can see on towards your right side, you see that like basically sciatic nerve starts in the L4 all the way to S3. And all those fibers basically come together and they form the sciatic nerve. The main function of the sciatic nerve is going to be to supply the nerve signal to the back of the leg. All right. So as we know here, it starts here, it comes together, it's going to come inside the pelvis. As it comes inside the pelvis, it's going to exit the pelvis, it's going to go towards the buttocks region. Once it gets to the buttocks, it's going to go to the back of the leg. And then right before it gets to the knee, it's going to split again. It's going to split again into smaller fibers. Then it's going to go down all the way down to the foot. So as you can see, it's a massive, massive, massive nerve that's going to have a lot of chances of getting impinged. But one of the things that I really want you to like grasp is that every nerve, as we know, has components of motor components, but also has a sensory component, right? So this is going to be important when it comes to your client telling you, oh, the pain is, look, I have a pain in my calf. I have a pain on the side of the leg. I have a pain on the inner part of the leg, or numbness, or all of that. That's going to help you read it. So I want you to just remember this. We're going to keep revisiting as we keep going. So main thing, the sciatic nerve, it only has a motor innervation to the hamstrings, meaning the hamstrings is gonna be able to turn it on and turn it off. That's the only motor component on the sciatic nerve. But it has a sensory, it only has a sensory component down to the calf area. So below the knee, all the way to the foot, it has a sensory component, meaning that numbing, tingling, stiffness kind of pain that you're gonna get in the calf, that's gonna be sciatic. So in other words, a client comes to you, they're like, oh, my hip hurts, I have this pain along the hip area, the tightness along the hip area, it's going to the side of the leg, it's going to the front of the leg. It's not going to be a sciatic nerve. So now you know you're going to cross that out. But if they also come to you, they're like, oh, my hamstrings, like for whatever reason lately, like they just feel numb. So now if you take a look at the picture on your right, there's a nerve on the green side. This is called posterior femoral cutaneous. So that nerve actually feeds or has the sensory component to the hamstrings. So in other words, so if the client comes to you and saying like, oh, my hamstrings feel a little numb or there's a little tingling along my hamstrings, it's not necessarily that it's sciatica, but it's also there's another nerve that's being involved too, called posterior femoral cutaneous. That's going to tell you that the impingement is happening along the spinal cord. So you can see how that just by listening to your clients complain, it can tell you where the impingement is happening. All right, so we're going to keep revisiting this idea so you guys can figure out what the impingement is happening. All right, so let's go to the next slide. So now that we talk about entrapment and impingement, let's figure out what is it and how we can, kind of picture that impingement happening. So the easiest way to understand an entrapment is actually to, if you think about, right now, let's say that you're going to go to Home Depot, Lowe's, you buy yourself a brand new water hose, you connect it to the faucet, you open the faucet, you're going to see a nice strong flow of water going through the faucet, to the water hose, right? Now, as we keep using it and sometimes we don't store it the right way, things are going to get crooked, right? Then there's going to be a kink happening along that water hose. The same concept, if you remember that, you take that to the body, the same thing will happen in a nerve. So if we're moving correctly, nerves and muscles, they're gonna flow nice and smooth. Things are gonna be working correctly. But if we start having compensatory patterns, something is not moving enough, or something is too loose or too weak, what's happening? The body's gonna start getting tight. If it gets tight, it starts getting compressed. So it's the same thing. So that there's gonna be a diminished flow of signal going through that nerve. All right, so you can see it from here from the pictures. I want you to just remember that because we're going to revisit it, later on during the PowerPoint. All right, so since Kento mentioned a little bit before, can you guys see there? There you go, perfect. That the main, I have a Chinese medicine background, so it's really interesting how, if you guys are aware of the, what's the name, Thomas Myers, and the functional lines and the fascia lines and all of that, how we connect the top of the body to the bottom of the foot. We have all those fascia lines, right? So in Chinese medicine, actually we utilize, or we have a different name for it. We call it meridians. The beauty of it is those meridians is how we connect the top of the body to the bottom, and then a lot of crosses and all of that. And then in Chinese medicine, we apply elements of nature to each of those meridians. Ironically, as you can see, this is one of the meridians on the right side. You can see it right here on the right side. You can see how the red line on the right side, it's called the bladder meridian. What's interesting is the element for that bladder meridian is going to be water. Same thing as a water hose, right? But you can see the pattern on the red lines that goes from the top of the head, but once it reaches the bottom or around the sacrum, it follows the same path of the sciatic nerve. It's almost like it almost mimics the common sites of entrapment that we're going to visit later, the entrapments of the sciatic. That's, I just find it really funny because the Chinese perspective, right? So now let's go to the next slide, which is going to be, we're going to find out those common sites of impingements. You guys are ready? Let's do this. All right. So the common sites, they're not in any specific order, but we were able to divide them into structural and more of a muscular components to it. So for this part, actually, I'm going to stop sharing. I'm going to show you in the model that I have behind me. I have it here. And you guys can see me here. And I'm going to use this. Can you guys see it? See me? Yep. Awesome. So first thing, we see this beautiful model right here, right? Right here. And as we know, this is the vertebral bodies, right? Along here, you're going to find the nerves and all of that, right? So we have the first element, or the first side of entrapment is actually going to be in between the vertebral bodies. Meaning is that if the spine, there's a little bit of a hinge along the spine, you're going to have something called herniation. So I'm actually going to show you right here. And then you can see it right here. So if we count the levels of the spine, it is 5, 4, and 3. Between 3 and 4, this body actually has a little bit of a herniation in here. And what really happens is, if the body, like the spine, is designed to move, right? One spot's more than the other. What really happens if is this spot or the thoracic spine is not moving, and this part of the lumbar spine or the pelvis doesn't move, what happens is the body will choose a level to start moving a little bit more. And what happens is that this little jelly-like substance acts like a cushion, but it also allows the body to move more and more, right? But if the body chooses one spot or the lumbar spine to move, to get the mobility, what happens is that spot will get basically like, too much work. If it gets too much work, it's going to start herniating or start slipping. If you can see from this picture, if let's say the slippage is getting bigger and bigger, it's going to start compressing on that nerve more and more and more and more and more. What happens is nerves don't like to be compressed. They're going to get irritated real quickly, and they're going to get damaged. So as you can see, if we look at the site around here, then impingement is one of the reasons of entrapment. All right. So now, if we stay actually in this area, it's going to take us to our second side of impingement. So as we know, these are the vertebral bodies, right? And inside we have the spinal cord. What happens is the spinal cord, in order to exit any of the extremities, it's going to make it through something called a canal, which is right here. You see this? And what happens as we age, sometimes due to hormonal changes or chemical changes in the body, what happens is like these canals, they're going to start getting smaller and smaller. So as they get smaller and smaller, they're going to start doing the same thing. They're going to start compressing or choking that nerve. You see it right here. So that's a second set of impingement. That each of them have their own symptoms, but now you know. All right. Now, if we stay along the spine, right? Now I want to take you to our third side of impingement. So as we know, the body moves in different ways, right? The body is dynamic and it moves in different ways and all of that, right? So things need to move, but sometimes things get stuck. So this is the pelvis, as we know, right? So, and the pelvis has to go one way this way and the other way this way, right? Sometimes what happens is, for whatever compensatory pattern that we can get into another day, things will get stuck. This side, the SI joint specifically, will get stuck. SI joint meaning the sacrum and the ilium, right? One of these sides is going to get stuck. What happens is, if one of those sides gets stuck, that's going to create like a little bit of a stretch or impingement along the structures around here. The main component that's going to get stretched or impinged is going to be this nerve that you're going to see. This is the sciatic nerve. This is when it exits the body. So as you know, like if your client is complaining of any pain along the back, is pinpointing, it's like, I have a pain right here. And then they're also having symptoms of sciatic, like numbing along the calf and all of that. Now you know that the impingement might be happening due to a structural component of the SI joint. All right, so that will be the third one. And actually, that can also take us to our fourth one. The fourth one is going to be related to a little bit muscles. Now, if we stay around the pelvis, and if the pelvis is not moving the right way, this is going to be the sciatic nerve, right? This is the right side, right? What happens is, if we want to move, let's say the femur, we want to extend the femur, or we want to extend the pelvis, right? We're going to have to use specific muscles for that, right? But due to our lifestyles, what happens is we start utilizing other muscles, or we don't use it at all, right? So the body, it still needs to move. So what happens is, if we're not using the proper muscles to move the femur or to move the pelvis, the body will start using the smaller muscles, the deep inside the body or deep inside the hip. They're called the deep rotators of the hip. What happens is, because they're small, they're not really designed to take that load of the whole body. right? So those muscles, what happens is they're gonna work for you because they're not gonna stop, right? But what happens is they're gonna start getting tight. As soon as it gets tight, one of the muscles specifically that's gonna get affected is a muscle that comes out through here. It's called piriformis muscle that I'm gonna show you in the next slide. That tiny muscle actually goes right on top of the piriformis or the sciatic nerve. I'm sorry. And you can see, like, if the muscle gets tight, it's gonna start pressing on the nerve. So let me take you to the next slide so you guys can see it better. Let me share the screen with you guys again. Can you guys see it? All right, so from here, if you look at this side, you see in here, the big muscles, of course, in here are gonna be the gluteus maximus, the hamstrings, of course, here they're gonna be the obliques and all of that, the core muscles. Well, what happens is when the body starts choosing to compensate, because you still need to move, you're gonna start utilizing the smaller muscles, which is, this is the piriformis, around here is the gemellus and all of that, like all different muscles that we can discuss another day. But you can see the muscle, the piriformis, goes right on top of the sciatic nerve. And you can see, like, if it gets tight, you can create that compression along that nerve. See it right here. Now, since we're talking about muscles, this is gonna take us to our fifth most common side of impingement. If we take a look at the screen in here, right? Let me just see if I can move this. If you take a look at the screen, you see a bigger muscle around here. This muscle right here belongs to the family of the hamstring muscles. So this and specifically, this muscle is called the long head of the biceps. All right, and so you can see this massive muscle actually covers a big chunk of that sciatic nerve. So you can also imagine if this muscle gets tight or for whatever reason, it's going to start pressing on the whole nerve, leading to symptoms down the chain or sometimes up the chain. All right. So what can you take from this? All right. So what can we do about it? So one of the things, of course, once we know the site or the pain or the source or that impingement by listening to our clients, what we can do is we can do the most obvious thing is we're going to start releasing it, right? We're going to use it through soft tissue. Like, I have my own ways of doing soft tissue. Kento has his own ways of doing soft tissue. You guys have your own ways of doing soft tissue work. You can do anything you want as long as it's fine. But the thing is, like, as we smart people that we are, we're not just going to release, right? We want to provide enough support for the body so things don't come back again. So you ask yourself, what can I do? You can just release it, but then how do I prevent things from happening? So one of the things that you can do is, of course, to keep the water flowing. If we take the concept of the water hose, is to keep the water flowing or to keep the nerve flowing. You know, make sure there's nothing on the way, so the nerve signal keeps going and going, right? So what can you, if we remember the biggest structure, or if you go back to this slide, actually, what's the biggest structure that we have in here? It's going to be the pelvis, right? And then if we see here, what's the biggest set of muscles that hugs the whole pelvis? They're basically going to be attaching all along here, all the way to the front. They're going to be the core muscles, right? And if we go from the inside out, from the core muscles, from the transverse abdominis to the internal oblique, external oblique, rectus abdominis, they all have to work in synchrony to keep this pelvis nice and stable, right? So as you can see, like, once these muscles build that stability or have that stability around the pelvis, these muscles in here won't have to work as much. So I want to take you to this slide so you can actually see it a little bit better. So if we look onto your left side, this is the picture of the obliques on the Western perspective, right? You can see the fibers going all along here and attaching all the way to basically surrounding or hugging the whole pelvis, almost like a suspension bridge. right? It's going to give that nice solid structure, right? So you can see like this, by utilizing this set of muscles, the pelvis is going to be in a better position. So the muscles in the back, such as the piriformis, the long head of the biceps, and all the SI joint is nice and stable, so it doesn't have to work as much. Hence, the result will be decreasing those symptoms. But one thing that the Chinese medicine bug keeps, popping up on me. So I wanted to share something with you guys, actually. So in Chinese medicine, the oblique system actually goes. Remember what I was saying before? That Chinese medicine relates a lot of things to things on nature. So the oblique system, which we know is in here, actually relates to elements of wood and elements of earth. So this is going to be the wood element, and this is going to be the earth element. It's very interesting because when I treat clients, after I release the source or the site of the pain in the back, could it be piriformis, hamstring, whatever it is that they, after release it, I go ahead and flip them, and I start basically stimulating points along this area, which are the oblique system. And then one of the things I wanted to actually when I was making this PowerPoint, it came up in my mind that is like, it's almost like if I was to take you to this picture or the stream, and you see how things are flowing, right? And if I want to bring water from here and want to make sure the water is flowing nice and smooth through all along the stream, I'm going to have elements of earth and elements of wood to give me that structure. And it's interesting for my brain as I can see like how acupuncture also looks at those elements to keep the water flowing. So if we go back to this slide, you see that they're using the elements of wood and earth, calling out for the obliques to activate, to keep the flow of water or the back flowing. Just like the bladder meridian we were talking about before, right? So in other words, it's beautiful to see how two medicines can come together, and they both emphasize the fact that we need to utilize the oblique system to bring the stability to the pelvis in order for the back muscles on the muscles that surround the sciatic nerve, they don't have to get tight. All right, so as you can see, again, in this picture, it's the same picture, just a little bit more of a zoom. You can use the from the inside out, transverse abdominis, external oblique, which is here, internal oblique, which is going to be here, and then, of course, the rectus abdominis. All right, I'm hoping that this helped a little bit clear up a little bit of the concepts of the anatomy. Now I want to open up for a little bit of Q&A time if you guys have some questions to, that I can help out with. Any questions, any concepts? Like, what was the biggest thing that you guys got from here? If you guys want to talk, remember that just press on the bottom left. There's going to be two buttons, right? There's going to be a microphone and there's going to be a camera. Make sure you press the microphone. Yes. And then you can do it.
Yeah. Stop sharing your screen so you can see your face.
Mm-hmm.
There you go.
I guess I have a question. That was very clear and direct, and I really enjoyed it. I got a lot out of it.
Yeah.
But I guess I wanted to get more into. I don't have a clear understanding of like what exactly like how like nutation, the counter nutation, I guess like the sacral movement independently of the pelvis. Maybe like what kind of causes that usually, and how that relates to the piriformis syndrome or the compression of the sciatic nerve.
Nice question. No, there's a lot of components that come when it comes to nutation. It all has to do with basically how the pelvis is moving, right? And it has to basically counteract each other, right? So if one side gets stuck for one reason, if you take a look at the pelvis, right? If you can see it here, if one side is stuck and the other one keeps moving, it's going to create this nutation in here. So at the end of the day, like, it's not so much about here. It's more about the muscles that surround the pelvis or that control the pelvic movement. Because the nutation is going to come from just a torque happening in here.
Mm-hmm.
And the torque will happen because, again, one side is moving too much and the other one not moving as much. So it basically has to do with the physical assessment. So once you take him through a movement pattern, and then you can see different kind of orthopedic testing, you can see what side is stuck. And then, of course, you can do any kind of from a PRI to any kind of like, any other orthopedic testing, you can see what size is stuck, what size is the one that needs some mobility. So this get basically loose. So the idea, because I know you wanted to compare it to the piriformis, right? What happens is the piriformis actually starts in the inner part of the sacrum, like around here. So it plays along with basically with your question of there's a mutation, that piriformis is going to be on a stretch. And sometimes what happens is if the piriformis gets on a stretch, the muscle will lock up. So the easy ways to understand it is like not just focus on the nutation here.
Right.
Look at the whole pelvis.
Right.
But that's going to free up the nutation or bring it back to neutral. So
Right,
you can work all day long and try to mobilize it. But if you don't work on this, it's going to go right back to it. It's just like releasing a piriformis and not working on the obliques.
Right. So, but generally speaking, you're saying like the sacrum is anteriorly tilted.
Yes.
Is the problem, and you're essentially trying to posterior tilt it to like improve the articulation over there.
Exactly. Yeah, it's looking at the whole picture, not just here.
Right.
Yeah, great question. Did I answer your question?
Yeah, I think so.
Yeah.
I appreciate it.
You're welcome. Anyone else has a question?
I love how you explained the connection between wood and earth and the water flowing and the pelvis. I don't have a question. I'm just busy like really thinking about that. That's so cool. And I love how you showed us with the picture and even how it works in nature and then how it works on the body. That's just such a great thing to think about.
Yeah, like, because like, at the end of the day, like, we can always talk about like between us clinicians, right? We can always talk about like, I can, this technical terms, but at the end of the day, the information has to be transferred to the client, right? So there's not just one way to explain it to the client. Every client has a different background. If you can simplify that concept and be able to talk to your client, so now your client, basically, you're both going to be on the same page. If you're both on the same page, if your client will be more motivated, you're going to be more motivated.
Yeah.
That's going to lead to better outcomes, right? So like,
Absolutely.
me, because I have the acupuncture background, so I like to basically connect those two type of medicines, which sounds like they're different, but at the end of the day, they're talking about the same thing. It's just a different accent.
Yeah.
It's a different way to describe it.
Yeah.
Yeah.
I'm so sorry I missed the beginning. Thank God you told me. But anyway, okay, I'll
We're gonna have a series of of the different anatomy stuff, so don't worry.
Oh, great. Oh, this is awesome. I love the format and it was great. Anyway, okay, I'll be quiet now.
Did you got more? Did you guys like more of the pictures or what do you like the more pictures or diagrams such as this or live models? What's more useful for you guys?
I think the combination of all the above was useful. I wouldn't really change anything in particular about it. Yeah.
Good. Yeah. Because we want to start adding those elements a little bit, this model, that model, and pictures, and, simplify it as much as possible for you guys.
Yeah, it all ties in for sure.
Yeah.
I find using the skeleton and the pelvis in 3D, for me, is very helpful. A picture sometimes is hard for me.
Yes. I know. I'm the same way. I'm the same way. I like to use the model. That's why we have this model at home.
Yeah.
So you want to see the front too? Look, it has a face.
Oh my God, that's awesome.
We love anatomy here. Then, Nanny, I got a question.
Yeah.
So how I can hear myself from over there since I'm pretty close. Anyway, so one thing I wanted to, because you explained it to me really well last time, is how when you look at Chinese medicine, right, when earth and wood is not working well, like what's on the obliques, and the bladder meridian is, let's say, kinked, does it also mean that the person's not grounded, even from a Chinese medicine standpoint?
Exactly. Think about it like, what's going to ground you, right? Is elements of you want to feel the earth. You want to have a good backbone, which is the wood element is going to give you that nice structure. And the earth is you're going to be able to feel the earth. And it's very interesting. Like, I don't, if I can find a picture, I mean, I don't have a picture right now, but if I can show you with a model, it's actually, remember those elements that I was telling you about, the earth element and then the wood element? They actually start in the feet. So the interesting thing is, if you take this beautiful model here, the element of earth is actually starts right here. So it's going to create, it starts at the arch. So it starts like you need to be properly grounded all the way from here. So you create a nice sturdy surface so you can start feeling a nice stability on the pelvis, and you can start feeling the obliques too. So it starts from the bottom up. The same element of wood too, it also starts in here in the middle of the foot. So it basically has a big emphasis on that arch and feeling the arch, feeling that ground before you start to feel the obliques and the adductors and all of the elements of the pelvis. So yeah. Any other questions, guys? What else do we have in here? Michelle, Ayako, Solana. What was the biggest thing you guys got from?
Sorry, one question. Can you explain? So this is a very elementary question. Sorry about that.
Bring it.
Explain to me why the stretch helps with the hamstring muscle that you said often is impacted by sciatica. I know the ball is directly on top of the piriformis.
Yes.
That's why it helps. But then externally rotating the femur and putting it that way, why does that help with sciatica?
Also, basically, it all depends on the side, right? It all depends on the side of the impingement. So if we take a look at the model, right?
Mm-hmm.
And you're talking about stretch.
Yeah.
Right? If we want to stretch basically the deep rotators of the hip, which start in here,
Mm-hmm.
right? So we want to make sure like things are nice and think about it, opening this area. Think about it, right? So there's different ways. But the thing is like because the sciatic. Let's see if I can put this part. Yeah. The sciatic is like literally like that's what we're saying, like a water hose. So if the put it here, right here. I want to use this. All right. So this is the sciatic. The piriformis is actually going to be right on top of it. So that if it gets tight, it's going to start squeezing that piriformis. Mm-hmm. So by stretching it, you're allowing that water flow again, or opening that water flow, opening that path. So there's different ways to stretch it. But if you're related to, the hamstring muscle, right? It's a little more complicated. You're going to have to properly assess if it's that tightness feeling is coming from a actual true lack of mobility or stiffness, or if it's coming actually from compensation, right?
Yes.
Because sometimes, what happens is if the pelvis is not put in the right position, right, it's tilted, right, then that nutation is going to be happening around here. Mm-hmm. What happens is the attachment actually of the pelvis or the hamstring is going to be right here. Mm-hmm. So if this is not positioned properly, the hamstring, put it here, the hamstring is going to be on a stretch.
Yes, I see. Mm-hmm.
What happens if it's going to be on a stretch, it's going to feel tight. Mm-hmm, mm-hmm. So you have to properly assess if this tightness is coming from a true tightness, mm-hmm. or is it coming from the pelvis not being in the right position? Because if this is in the right position, then the hamstring can go back to being nice and loose.
I see.
So there's different ways of course, assessment. But you just make sure that you're stretching the muscle that needs to be stretched, not just for the sake of stretching.
Nice. And even though external rotation will contract the piriformis, mm-hmm. stretch will still release the piriformis.
If the symptom is coming directly from around, I mean, the patient most likely is going to tell you, oh, I have a deep tightness around my hip. Mm-hmm, mm-hmm. Something around my butt really, really, really hurts, or it feels really tight. And then I get in symptoms in my calf. And as I keep working out, I keep doing kettlebell swings. I keep doing, deadlifts and squat. And I'm not using the right muscles. And that pain keeps getting worse because I keep utilizing the smaller muscles in here instead of using the big picture muscles, right?
Yeah.
So if they tell you like it keeps getting worse with exercise, it keps getting worse with activity, and it's like a deep pain, now you know that the symptom is here. It doesn't matter. It's not so much about the external rotator and all of that. It's more about listening to the client and where the symptom is coming from.
Mm-hmm. Yes. Okay. So the stretch that you showed us is effective because even though you're externally rotating the femur, which normally would contract the piriformis, but you're putting a ball underneath the piriformis.
Exactly. Yeah, that's what we had. We had the little like the ball. Exactly. Yeah.
Got it.
That
Okay. And I'm sorry if I'm asking a question you went over.
No, that's what we're here for.
Okay.
But the idea is like, after you release it, right? Because you're not just
Yeah.
going to release it, you're going to follow it up with a corrective exercise, so something to engage.
To stabilize the pelvis, what you do.
Exactly.
Okay, awesome.
Which is going to give you the long-lasting effect of that release.
Great. And I just have to give you feedback. I love that you explained all the muscles and the importance of stabilizing the pelvis. I hadn't really thought about that before.
Yeah, because like think about it, right? The attachment, like
Performance.
basically, is almost like the core is almost like hugging
Yeah.
the pelvis, right? That's what the attachment are here. And that's something that that we can make another a seminar about it. You're just explaining the attachments of the core muscles and the importance of it.
Yeah.
But yeah, that's something that we can do some other day if you guys want.
Great. Oh, thank you.
You're welcome. Anyone else? Any other questions? Let me see. Kento, you want to tell him a little bit about remind him about the little offer that we were doing?
Am I on?
Yeah.
Oh, yeah. So if anyone's still interested, I mean, we're trying to give out certain things, especially at times that we're, I don't know if you guys are all bored. I'm going crazy with the kids, to be honest. There's more stuff to do. However, we want to try to help as many people as possible because we don't know what's out there and what's good. So if those are on the call or do see this video again, we are offering out like 10 complimentary virtual sessions. So if you want to learn more from myself or Danny, or if you have any issues that maybe even movement issue, you might not even have like a crazy pain issue, but you do have instability or weakness when you do a push-up or when you do a shoulder press, whatever it is. We're very good at it, or at least we have a lot of confidence in it. Let's put it that way. We can't say it will fix every single person, but we have enough confidence in it. So, if you guys are interested, feel free to put that on the chat or, message me through Facebook, message us through the Kamiyama Physical Therapy page, and we'll love to help. But if there's more questions, I mean, please take up our time because if I go home right now, my kids will kind of annihilate me from my time. So I'm actually enjoying these adulty times right now.
Can I ask you a question regarding the promotion?
Yeah, go ahead.
Is that like accessible for like my clients, or is it just for us on here now? Is it for therapists?
So the priority, so the priority will be you guys because you guys joined with us. But if you do have a client that you will do that, then I will probably give you something.
You just turned to Darth Vader on that last sentence. I didn't hear what you said.
I think it's breaking up. Hold on 1 second. Let's try to fix this. Give me
I'll go to Danny.
1 second. Yeah. Technical difficulties. Can you hear it now?
Yeah, loud and clear. Loud and clear.
Did I just break up? Is that what happened?
Technical.
Like the whole spiel. Do it over.
Oh. Coronavirus is in the computer right now. It's getting sick.
No. Okay. Can you hear me now?
Unfortunately, yeah.
Okay, good. So if it's from you personally, I'm totally okay with that. And they just have to make sure Paul's the one that referred towards me, and I will be giving you also a complimentary because of the referral aspect of it.
Oh yeah, for sure.
You meaning like all of you guys?
Yeah. Okay, that's cool. I think I'm gonna take advantage of that. I have some people.
Go for it.
I have some clients in mind. Yeah, for sure.
Yeah, it's the time right now too.
Because make the most out of it.
Yeah, the way we practice too, at least we're so movement based that for those that are having physical therapy with, let's say, some physical therapist that has a lot of hands-on activation with it, it's really difficult to do virtual. But the way I practice, luckily, and I say luckily, that we'll do a lot of movement stuff. So virtual session hasn't been too much of a disadvantage for us. So the results been quite good.
Yeah, because you don't necessarily do a lot of manual therapy. You more teach people how to undo their own pain through cueing and stuff like that.
Exactly. So they can replicate it at home. So that way, they don't need it constantly.
Sure.
So they can actually progress even faster because they can do it at home.
Super autonomous. Yeah.
Anything else? I'm seeing Solana. I don't know if you have any question. You keep just waving.
Sorry. I just keep waving at you guys. I don't really think, because everyone kind of said everything via question. I guess I could ask this. So, someone has sciatica, whatever, they come to you, and they're like, yeah, my piriform is killing me. So you stretch it, release it. What's, your go-to stabilizer movement for them if they just know nothing about anything? They just suck at moving in general. They're like, what's the go-to? Okay, even a dumbass can get this. Let's try to get you to understand.
Literally, you told them. Even the dumbass can get this. If you don't get this,
I'm gonna cut that. I'm gonna cut that part of this video, by the way.
Sorry.
No, that's okay. That's not a problem. So let me repeat that. Danny's gonna answer it. So you're saying
PG version.
He's gonna.
This is why I've been waving and being quiet.
Right. So if it's a general exercise, assuming that we didn't really assess anything, but anything stabilizing that is easy enough for anyone to do, for the most part, what would be our go-to?
Yes.
Yeah, sure. All right, Danny, go for it.
So it could be simple, it's basically it depends what approach you want to take. So if you want to take the approach of basically of having them utilize or decrease the use of the deep rotators, so you can try to basically teach them how to do a proper hinge, basically a hip hinge. Because what happens is that for the most part, people when they do a deadlift, they start doing this, but they start kind of when they go to the top, they kind of squeeze the butt too much and too soon. What's happening is then they start utilizing the deep rotators. So you can start teaching them how to shift the weight properly back and then properly come up, and then by basically pushing the ground away from the floor, you can, if you want to use that method, right? If you want to take the approach of going from the top bottom, you can you start utilizing the exercises to engage the obliques. There's many ways to do it. We're not, we are biased in one way, because the way we treat. But as long as you start getting the patient to feel the oblique, you can start doing that after you release it. But it all depends on what way you want to approach it. Top to bottom, bottom to top.
I have a quick one, Solana, that I might. So you talked about
the hip hinge,
right? Hip hinge and obliques. So obliques are a big one, at least. So I'm going to stick with our sciatica PowerPoint a little bit. So obliques are harder to feel, right? We have there's many exercises out there that's oblique focus, but really from our experience, that it's really important for the patients to be able to actually sense it and feel it. So one thing that I might just use is maybe a plank or a push-up position plank. And what I tell people that are very, let's say, I don't know, tight in their back or tight in their center of their abs, I just have them kind of shift back and forth from right and left as they are breathing or just doing a plank. By doing so, your weight shifting right to left, which almost reflexively has to activate right oblique, left oblique, right oblique, left oblique, because you're shifting the weight. Mm-hmm. And that shaking aspect also kind of shakes, you have to adapt.
Kind of wakes up the brain, kind of oh, this is my right side. Oh, that's my left side.
Okay.
So that, in the nicest way possible for individuals that are motor incompetent, in a nice way to put it, that might be how I would do it.
Okay, I like that. Thank you.
Wait, what part of you the motor incompetent one or the concept? Which one?
Both. No, both. But I like that you explained, because like when it comes to obliques, like I don't understand how to get a client to feel it, because they're just like, what? And I'm just like, forget it, just plank. Like I don't know what to do.
It's not bad. It's hard. It's hard to feel the obliques. But you know, like instead of just shifting the weight and get him to feel, it's like, oh, that's my right side. Oh, that's my left side. You can do it.
Yeah,
especially if you incorporate it with breathing, right? With not like tension. It's just like you know, side to side.
Yes. Thank you. I will use that.
Let's see if Michelle wants anything.
Michelle, any questions? Michelle Foster?
You told me about this, by the way.
Oh, okay, I know. Okay, got it. Very nice to finally meet you.
Oh, I picked you up a long time ago because I used to train with Elish. It was like a year and a half ago when I ruined my back.
Oh, memories.
Wow. Well, thank you for joining us. That's awesome.
I'm so excited. Finally got here.
All right, Michelle's going to stay quiet.
Quiet. She's just grasping the concept.
Yes.
There she is.
Go ahead.
I think you know, for just hopefully you guys, you know, were able to grasp a little bit of that concept, you know, a little bit of the anatomy. Hopefully I was able to simplify the concept, and we're hoping to make this a series.
Yeah, so we're thinking of doing one next week, just because. I mean, I have a feeling we're going to be like this for 3 months right now. So we're going to do one on hip next week. Since you guys are already here, do you guys have a certain hip one that you guys want to know? You know, possibly a diagnosis or
something common along with your clients, something common that you hear.
Yeah. Hip it is.
Yeah.
You mean a kind of hip? I mean, I'd love to understand more about hip impingement.
Hip impingement, okay.
Yes.
All right, hip impingement.
But everything relating to the hip is great. When you guys talk, I love listening, so you can talk about anything.
All right, hip impingement.
Hip it is. Hip impingement is. All right. If you guys don't have any further questions, thanks for joining, guys. Same thing. If you guys have clients that you have that you want us to help us out with, it will be complimentary, but it has to be through you guys, by the way. It won't be just anyone else. And, we'll send out an email again for next week on Wednesday, possibly Wednesday or Tuesday. We'll see the timing of it. But thanks for joining. Danny, kind of just finish it off, if you don't mind.
I hope you guys learned a little bit about it. And then I hope to see you guys soon. Hopefully next week, right? If it's Tuesday or Wednesday. It's next week. All right, guys. Take care.
Take care. Thanks for everything, guys.
Bye, Bob.
Thank you. Bye.
Bye. Thanks for watching this video. If you found that helpful, and if you now are thinking that I wonder what else this person can help me with, please go to our website at www.kamiyamapt.com and find other free contents or apply to our free discovery visits to further see if we can help you. For any further information, please email us at info@kamiyamapt.com. Thank you so much.